just the physical act of smoking a cigarette and driving. When you're in a car, you have to reach for the cigarette and you're driving. So you're taking one hand off the wheel to get the cigarette, put it in your mouth. Now you're looking for a lighter. So you're digging around looking for your lighter. You know, distracted driving is the second probably most cause of accidents in Louisiana, distracted driving. So putting on makeup in a car, that's dangerous. You know, handing a child a bottle. If your child's crying in the back seat, handing a bottle. But a veteran that's experiencing a PTSD episode, some severe trauma that they experienced in Iraq. You know, we can't keep sending our young men and women to Iraq to fight these wars. And they experience, when driving highway safety in Iraq, the 63% of highway deaths in Iraq was IEDs. So these veterans come back and they're riding in a car, maybe their wife's driving, and they see a piece of road debris, and it triggers this in their brain. They think an IED, and they go into this traumatic episode that puts them back in Iraq, and the sweating and the hypervigilance and all that comes out. Well, the vaporization is the easiest way to deal with that. He takes the vape out and he hits one vape. You know, we heard some things about hotboxing, the effects of cannabis on people in the car. Most of the cannabis, when you ingest it, when you inhale it, 60% of it's in your body. So you're blowing out maybe 40%. Some of the tests that were done, you had 3 or 4 people in a small enclosure smoking for 3 or 4 hours, and they tested the people that were in the room that didn't smoke cannabis on a normal basis, and they had a small percentage of cannabis in their system. Wasn't enough to be under the influence and driving. So what we're doing, this law here, this bill, if it passes as written, is we're criminalizing those veterans that need cannabis as medicine. Because right now, any other cannabis in Louisiana is illegal. You know, so a veteran riding in a car that hits a vape pen is not going to be as dangerous as putting your makeup on or handing a child a bottle when you're driving, or smoking a cigarette when you're driving. You know, you still got to take your mind off of what you're doing. You take your hands off of the wheel, and you take your vision off of the road. All those things affect, accidents. So we oppose this bill mainly because it interferes with the doctor-patient relationship. When a doctor recommends cannabis for a veteran, it's for a reason. He's trying to keep the veteran off of opiates or other harmful drugs. So I'm open to any questions.
I don't really have a question. I just want to thank you for coming here.
Yes, sir.
God bless you. I know what you're talking about. I got friends who were blown up and suffer with all that, and these are really, really hard issues.
Thank you, sir.
Thank you. God bless.